Today I will be demonstrating grade 3 joint mobilization in an overhead athlete with a chronic rotator cuff strain and decreased movement. Grade 3 is used to treat stiffness and increase RUM and stretch out the muscles that are in the area. So before you start with joint mobilization, you want to warm up the tissues. So you can do that with ultrasound or a massage. Just make sure that the tissues are deeply heated. To start off, you're going to make sure that the patient's on close to the edge of the table, and you're going to stabilize and distract with your non-dominant hand. So you're going to pull on it, distract, and then you're going to take your dominant hand by the joint line, and you're going to press posteriorly, because you're posteriorly mobilizing opposed to anterior mobilizing. So I'm going to do that again. And you're going to use large amplitude motions to feel tissue stretch. I will now be using grade 2 joint mobilization on an MCL sprain of the knee with mild swelling. So grade 2 was chosen to help decrease the pain that's in the area. To do this, you're going to want to warm up the tissues again with either ultrasound or a massage. You'll take your non-dominant hand to stabilize by the quad, and then you'll take your dominant hand behind the knee, similar to a Lockman's, and you're just going to pull forward while pushing down with this hand. And you're looking for small movements because you don't want to push the tissues too far. For an ATF sprain with joint effusion, you would not use joint mobilization because it is a contraindication. To treat joint effusion, you could use pulse ultrasound, ice, and elevation.